You may have noticed new flyers and business cards from AVDA, Aid to Victims of Domestic Abuse, in the exam rooms. We hope you and your patients find this information useful. Domestic abuse, also known as domestic violence and as intimate partner violence, is common. Because intimate partner violence can lead to significant, acute, and long-term health consequences, many national health organizations recommend screening for and addressing intimate partner violence. We, as health professionals, have a potentially life-saving opportunity to help our patients who are experiencing intimate partner violence and may not seek services or help elsewhere. To address intimate partner violence or domestic abuse, here are a few strategies to help us recognize, respond, and refer to cases of partner violence. One approach that I use is to ask my patients about partner violence when I'm interviewing them about their social history. I ensure that the patient is in a safe, private setting when I ask about drugs, alcohol, and violence. For example, I'm going to ask my patient during the social history. Violence is a common problem that many of my patients has experienced. It can affect your health. Have you now or ever been in a relationship where you've been hurt by a partner, slapped, punched, kicked, or felt afraid of your partner, threatened by your partner?
It's really, really hard to talk about, but yes, I've been slapped a couple of times. I even was choked once. I think I passed out. He apologized. He'd been drinking. He was stressed out by his job. He said it would never happen again, but it was scary, and I'm still afraid.
It's key to respond to a disclosure non-judgmentally, with empathy, and to provide resources and referrals, and anyone in the healthcare team can do that. For example, thank you for sharing that information with me. I'm sorry that you had such a scary experience. You did not deserve to be treated that way. And there's help out there. And are you safe to go home right now?
I think so.
Okay. So many of my patients have found resources helpful, such as AVDA, Aid to Victims of Domestic Abuse, which can provide counseling, legal services, and other support. If it's safe for you to take this information, a card and a brochure, I'd love for you to have this so you have access to other resources. The other thing that's really important is sometimes it's difficult for patients to make private phone calls. Would you like to use one of our exam rooms to make a private call today?
Yes, please.
Another more indirect strategy that I sometimes use is if I notice a suspicious looking bruise on somebody, or if someone's having symptoms of a lot of anxiety, complaining of difficulty sleeping, or have any kind of chronic pain, I often will ask patients, for example, some of my patients that have these symptoms have experienced violence in their lives at the hands of a partner. Has that ever happened to you before?
It has. And that's part of why I came in today. I didn't want to tell you, but yes, the bruise is because of what happened last night.
AVDA provides survivors of domestic violence with free legal representation for protective orders, divorce, child support, child custody, as well as free trauma counseling and other services. AVDA's Battering, Intervention, and Prevention program helps perpetrators overcome abusive behavior. Remember, recognize, respond, and refer for suspected cases of domestic violence.